thing we are going to discuss is another work-related disease. Okay, so this disease, you are likely to get it. Okay, and that's if you work in places that they mine coal. So in general, it is called what? Pneumoconiosis. But us as medical students now, we don't want to know it in a general way. We want to know the different types of pneumoconiosis. So the first one we're looking at is a fibrotic. And of course, when you say something is a fiber, it's very simple. You know, the normal meat appearance is now becoming like wood. Okay, the cells are dying, they are becoming necrotic. So it's a chronic occupational lung disease, and it's caused by long-term exposure to mineral dust. It could be coal, it could be silica, it could be asbestos, leading to lung scarring. So your lung is actually, you know, becoming fibrotic. Okay, lung is becoming fibrotic. So what is fibrotic pneumoconiosis? It's a type of pneumoconiosis, and it's characterized by fibrosis, which is scarring of the lung tissue due to dust inhalation. The dust could be coal, it could be silica, it could be asbestos. So occupational link is common in miners, common in construction workers, common in textile workers, common in industries with high dust exposure. So pathology is a dust that triggers chronic inflammation, immune response, scar tissue formation, stiff and less elastic lungs. So causes and risk factors is coal dust could lead to what? Coal workers pneumoconiosis. Silica dust could lead to silicosis. Asbestos fibers could lead to what? Asbestosis. Okay, so we have other ones like beryllium, hard metals, cotton fibers, a lot of that. So risk factors is long-term exposure, you know, poor ventilation and inadequate protective what? Equipment, smoking too. So symptoms is early stage is usually no symptoms, right? So that's why you see those people, they work in that industry for a very long time without even knowing that they have such an issue, you know. Then chronic, you could actually cause a lot of shortness of breath, chest tightening, they are weak, severe respiratory impairments, pulmonary hypertension. There's also risks of them contacting tuberculosis. Okay, so that's what we got for that. Then what again? Diagnosis is all those occupational history is very important. So you have to ask them where do they work. In fact, for all patients, always ask them where do they work. Okay, then checks X-rays and CT scans, pulmonary function test. Then sometimes biopsy. This is when if you are suspecting as if it's a cancer, they have to go and confirm it. Treatment is there's no cure. Fibrosis is irreversible. The person will die. Okay. So supportive care for the meantime, you just try to handle. Their breathing. Just make sure that they breathe very well. You know, make sure they breathe very well. You know, medications for symptom relief, pulmonary rehabilitation, prevent any complications from coming in. So this is what we got.